Dude, it's literally Kathleen. Hi, Kathleen. It's just gonna be us talking. Right. Come here.
And your suitcase.
Hang out on my suitcase. So what did we just do? We did a podcast with Dr. Williams talking about fibrosis after liposuction, talking about manual lymph drainage, talking about cavitation, talking about self-massage. What else?
Foams. Talked about foams.
Yeah, we did that.
We talked about the burn unit.
Oh, the burn unit. Yeah, we don't know when the podcast is coming out yet. I will let you guys know. It'll be on our podcast as well. If you don't follow that, we're on Apple, Google, Spotify, all the places. So go follow that now, because the minute they release the podcast, we're going to release it on ours. And then it's going to be, I think, on YouTube. So I'll take the video and put it on our YouTube as well. So if you don't follow our YouTube channel, all the links are in the bio. So go ahead and do that. Guys, for those of you who don't know, Kathleen and I have been friends for years. This is the first time we're meeting in person. So this is kind of like a big deal for us as like friends. This is like a huge moment. So just wanted to share that with you guys. What else you got? Anything?
She wore that bow.
I did. Actually, I wore the pink bow that I wear, my signature bow that I wear in every video, all the time, every day. This is my other bow, but I wore the pink bow. Because this was a little bit extra. This is a lot with the lipstick, so I just wore the regular bow. What else?
I really liked having the opportunity to talk to a doctor that loved the lymphatic system. Yes. Like all of my surgeons that come to see me, they all seem to have that one particular situation, that one particular patient that patient seek lymphatic therapy, and they saw the results of lymphatic therapy, and that's why they have the respect for us as professionals. So if you're also a lymphatic professional, know that every time you put your hands on a patient, it's a potential opportunity to give not only the patient but their doctor information on this very underutilized system as far as medical education is.
The other thing we talked about is the difference between manual lymphatic drainage and just a lymphatic massage, or just a regular massage.
Or a spa massage.
Or a spa massage. We talked about that like in depth on the podcast. I know I talk about it all the time, so does Kathleen. Not incisional drainage. We are not pushing fluid. After surgery, no one is pushing fluid either out of your body or in your body. There is no long pushing strokes. It is a scientific medical modality. We are stretching and gently pumping the skin to get your body to do its natural job, reabsorb the swelling, and get it out through your urine. So we did talk about that at length, which was really great. I think the other thing is it was really cool to have an opportunity to speak with a surgeon who he actually brought the Vader book with him. He went out and bought a manual lymphatic drainage book.
Read a book on manual lymphatic drainage after he had a CLT when he was out back working at the hospital, really show him the effect of manual lymphatic drainage on lower limb injuries. So he saw the effect of it, and then he knew he was going to meet two more people who had the training for lymphatic massage, manual lymphatic drainage, and that inspired him to go buy a textbook and get back to basics and read about this system.
Yeah, and I don't think a lot of surgeons do that. A lot of them, and I say this to you guys all the time, talk to your surgeon. Your surgeon is only human. They don't know everything. It is not their fault that they don't know what they don't know. They don't get trained in it. So the one thing I love about Dr. William is that he actually does the deeper educating and the deeper knowledge understanding of what these things are, so he can tell you guys, like having us on the podcast who are professionals, experts in this field, to be able to explain not just answer questions about cavitation like we do, through Instagram, but actually talk about the science of it, what it is, why we're doing it, how it helps, to really educate you guys on what you need to be doing so you can make the right choices. That's not saying you guys don't, shouldn't go get cavitation. It's just, when should you go get it done, right? When is it appropriate? How and why? And all these important questions that Kathleen and I answer all the time. Dr. Williams asked us a bunch of those so that we can educate you guys on them. So that was real cool. Kathleen brought her little bag of goodies over there, foams and all kinds of things. I brought the Amare Lipo foams, so we talk about that and how to use your foams to get rid of fibrosis and to help soften fibrosis so your MLD therapist can get rid of the fibrosis. So there was a lot. It was long. It was like 3 hours. It was a lot. of podcast. So that'll go up when you guys get it. When I get it, you guys will get it. So that'll go up at some point. You got anything else you want to tell people on the webs, on the interwebs of the Instagrams?
I'm not eating alligator.
Okay. All right. So let's get into the fun part of this live. All right. So Kathleen has an aversion to alligators. I do not.
Well, a culinary dietary aversion to alligators, much like other animals.
I thought we should go get alligator for lunch. Kathleen refuses. So we will not be eating any alligator today. So I am Moana. She is Hey Hey.
I'm Hey Hey.
She is my Hey Hey. She supports all of the goddess things.
Everyone needs Hey Hey.
Everyone needs a Hey Hey. And Kathleen is my Hey Hey. She is she saves the heart of KVT. So there's that. I think that's a pretty good summary of our trip.
Yep, we're going to the beach now.
We're going to the beach. Bye, guys.